everybody. I hope you're all well. So today our topic is genetics and nutrition. That's exciting, right? So let me introduce myself. My name is Anjali, and my profession is women's health movement coach and nutrition counselor. Hi, Emma. Welcome. Nutrition counselor, as well as my passion is this platform. I love bringing practitioners together and closing the gap between the traditional and modern medicine, and keeping this platform educational for the sake of awareness. All right. Hi, Emma. Guest. So she is going to come on live soon. So we are waiting. Here she is. Hi, Fatima. How are you?
I am great. How are you?
That's awesome. So thank you for your time and your knowledge. That last year it was so popular.
Is it?
Your talk. Yes, it was amazing. So yeah, thank you. Thank you for being here again. And yeah, would you like to introduce yourself
Yeah, absolutely.
to
So my name,
our guest?
absolutely. Sorry, your connection is a little bit laggy, so I'll pause.
Or glitching? I'll move somewhere. I wonder if that would be better.
That's all right. I can
Is
I
that
can do an introduction while you're
okay?
doing that.
Yeah,
So
I'll
yeah,
try
my
to
name is
find.
Yeah, my name is Fatima Abdullah. I am a dietitian as well as a nutritionist. I've been a dietitian for almost 15 years now, currently based in Brisbane, Australia. So I see people in person as well as online. And my area of expertise or my passion area is basically weight loss and management of chronic diseases with a focus in on culture, so that means cultural foods, cultural practices, looking at people from multiple different backgrounds and showing them how they can apply the information that they learn from dietitians to their individual circumstances, because that is one big barrier that people face, is that the advice that they get or the foods that they see online, it doesn't represent their cultural foods. So over the years, that's really where I have come in and sort of really focused in on. But yeah, I've spent about 8 years of my career living and working in Zambia as well. So I have a strong background in the African nutrition space as well.
That's amazing. Okay, so can you see me better now?
That's so much better, 100%.
Uh, Okay, okay.
Yeah.
Thank you. Welcome everybody for being here. Thank you for being here. So today we have an amazing Fatima. I said an amazing Fatima. Yes. My English sometimes it's like I have to question myself. So all right, thank you everyone. So before we start, I just wanted to read out this disclaimer that this chat is all about to bring awareness, not a specific medical advice to anybody. And if you would like, or if you wish to connect with Fatima directly on this topic, please do, and we will put all the details of website link and all the how you can get in touch with her. We'll put in the content, and please see your a healthcare practitioner if you're needing support around this. All right, so are we ready?
Yeah, let's go.
Yes, let's go. So the first thing is like, what does genetic awareness mean in the context of nutrition and health?
Yeah. So genetic awareness is just pretty much being aware of the kind of things that your genes predispose you to with
Mhm.
regards to things like nutrition and health, right? So we've all got loads and loads of different genes. Genes are basically the things that have pre-programmed in you. You get them when you're born, you inherit them from your parents, from your great-grandparents, your ancestors. Your genes are basically what make you who you are.
Mhm.
And part of those will be certain genes that are involved in how your body functions, which is linked, of course, to your health. So an example would be in the ethnicity of people who are South Asian, they
Mm,
have genes that predispose them to things like diabetes and
mm,
PCOS, right? So if you are
mm,
of that ethnicity, you're most likely going to be getting these genes. They're going to increase your risk of getting these conditions.
mm.
And it's not something that we need to fear. It's not like, oh, these are my genes, that's it. When I get older, I am going to get diabetes or I'm
Yeah.
going to get PCOS. It's not a because I've been given this or I have it in my body, this is the reason why it's happened to me. And we're going to
Mm-hmm.
talk about that in so much more detail today. But it's good to know with regards to your family history, your family tree, as well as your ethnic background,
Background.
what
Mm,
sorts of genes related to
yes.
your health are you going to be predisposed to? So that awareness of understanding and knowing, okay, I need to make sure I watch and control my carbohydrate intake because I'm
Mm-hmm.
predisposed to diabetes. I've got a grandfather and a grandmother and a mom and a dad who all have diabetes. So hey, I really need to look after myself. That's awareness, right?
Yeah.
It's not fear, but it's awareness of knowing what do I need to do with regards to my food choices, my movement choices, my sleep choices to really basically foster the right environment.
Mm. So I love how you put in that it's about being aware, not about fearing it, right? That doesn't just because your forefathers had that, that
Yeah.
doesn't mean it's set in stone. You're going to get it for exact, right?
Mhm.
So we have a hope and we have exciting news.
Yeah. Yeah.
Awesome. So, all right. So, as we are a women's health platform, so let's go into how can women from different cultural background approach their inherent health risk, like you already mentioned about the diabetes and PCOS, right?
Yeah.
And through food.
Yeah, 100%. I might use this opportunity to actually talk about some of those really common ethnicities and some of the things that they are predisposed to, because I think a lot of people probably maybe are unaware of it. Maybe you're very aware
Mm,
of it. Maybe your family talks about it all the time. Oh, us, Abdullahs, we all have heart disease, so
mm-hmm,
be careful, or but generally you can go and search this online and have a look and understand more. But South Asian communities, so this is going to be people who are Indian, Pakistani, Bangladeshi, Sri Lankan, those South Asian
mm-hmm,
sort of areas, they are predisposed to things like type 2 diabetes, PCOS. They have more abdominal obesity and insulin resistance. Um,
mm,
and that, again, is got to do with certain types of hormones that they have, right?
yeah.
African or people from the African diaspora, Nigerian, Zambian, those even people from the Caribbean, Jamaican Caribbean, they have a really strong disposition to high blood pressure. So they
Mm.
are very salt sensitive as a population, right?
But we
They
love
also have
salt. We
yes,
love salt
yeah.
and spicy.
Yeah, yeah. And there's a difference between a spice and a salt, right? Salt
Yeah,
is the
yes.
king of flavor. It carries the flavor, but the spice is what is the flavor, right? It's like salt
Mm,
brings out the flavor. So they are very salt sensitive. And they also have traits for things like sickle cell disease and conditions that we very really get in a lot of other ethnicities. So there's some really
mm,
unique sort of conditions as well when it comes to that population. Middle Eastern or North African sort of people, generally, things like diabetes, central obesity, and high cholesterol are pretty high. So
mm,
they, again, should be aware of these sorts of things. East Asian communities, lactose intolerance is really, really common.
mm,
Alcohol, they really, really struggle with digestion of alcohol. So they've got a very low tolerance level
mm.
of alcohol. And I'm sure you've seen, even maybe online, how, it was like a joke,
Yeah,
uh,
they get
the
the
red the
rosy
red the
cheeks,
red
and
red
yeah, the
cheeks. Yeah,
ears get really
yeah,
red.
yeah, that's
Yes,
it. Whenever
yes.
they drink, yeah, that's it.
Mm,
And they also have a few other elements as well, but those are the top ones. Here in Australia, we've got a very big community of like Samoan, Pacific Islanders, Maori people. They are very predisposed to things like gout and heart disease,
Mm.
as well as metabolic syndrome, which is basically a whole host of different elements, right? Lastly, with our Aboriginal First Nation people, they are at high risk of things like kidney disease, as well as heart
Mm.
disease and gestational diabetes. So that's diabetes when you're pregnant. So
Mm.
each subset of group of people are slightly more predisposed to some of these things. And so I think step one in terms of how do people from different backgrounds approach this is number one, know what you're predisposed to,
Mm.
understand your family history and
Knowing the
what's
history of
there.
it.
Yeah.
Mm.
And it's a really cool topic because it's not just the genes that you've been given, but your environment actually really shapes it. So I'll give myself as an
Mm.
example. My
Yes.
genetics, my heritage, I am
Yes.
Indian Pakistani. Okay.
Mm.
But I'm third generation Zimbabwean, which means that my grandparents, my parents, and myself and my siblings were all born in Zimbabwe. So the
Wow.
way that our genetics has been shaped, even the way that we look is different to someone who's lived in
Mm.
India their entire life.
India. Yes.
Okay. It's really cool. And my palate is different. My genetics has probably changed over the years. All of those things have been influenced by the fact that I've actually lived in another country for so long and I was born in a different country. And so your environment can actually really impact you because
Change the.
people who know or understand, hi, Helen, she said she's from Zimbabwe too.
Oh, bless. Hi.
Mangwanani. So we have that influence, right?
Mm.
Someone from India is going to look at me and go, "You're not Indian."
You're not Indian.
Right? Or they're going to straight up look at me, "You're South African, aren't you?" Right? Because our features have changed. So
Yes.
internally there's a lot of things. So your environment absolutely plays a role, and your part of your environment is the habits that you have, right? It's
Mm.
not just
Yes.
the weather and the germs that you're exposed to and whatever, but the lifestyle and the habits that you have make a difference, right? So
Mm.
this little element of just understanding that you our body is very adaptable means there's a lot of things you can do to control or manage what you've inherited, right? Example, I'm prone to diabetes. I'm going to be aware of how much refined sugar I have. I'm going to try and keep my weight in check. I'm going to avoid, if I have high blood pressure risk, I'm going to avoid putting as much salt in my meals. These
Mm.
are the little small things, I guess, that people can do is just laying the foundation of healthy habits
Mm.
will
Just
basically
changing it slightly.
offset your risk. Yeah.
Mm. You don't
Um,
have to do the drastic change, right? You're just
no,
being
no.
aware and just being mindful and just little changes, like you
Yeah.
said.
And the beauty actually is that if you look at the foundation of what the general recommendations are for being healthy,
Mm.
that as a baseline is already going to offset or reduce the risk or delay the onset of these genetics that you might have, right?
Mm.
So you basically control what you can control and
Yes.
be comfortable with, oh, I ticked everything on the list. I did this, I did this, I did this to my best of my capacity. And now if genetics are turned on and I get this, I can know that I comfortably can say I did everything. And I'm still going to
Yes.
carry on those habits, but I know that maybe my genetics are super, super, super strong because despite that, I still got it. And it could be that because you have all these healthy habits, you offset getting diabetes for 20, 30 years. And maybe you only get it in
Mm.
your 70s rather than getting it in your 40s, right?
Yes. Yeah. 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 I have a one question. It's not on our list,
Okay,
but
fine.
the healthy has been taken to so many. Oh, sometimes I feel like it has been taken to such an extreme level, and we follow all these diets. They fad, whatever comes in a market, we start thinking that this is the healthiest one, and then we jump into it and it doesn't work. And how do you define healthy? How do for simple people, to make them not overwhelmed by it, how would you define healthy and, guide them towards it?
Yeah. So I can answer that question in more detail with regards to diet. But before I do the diet side, I think it's important to note the other lifestyle factors that play a role
Mm-hmm.
because everything is completely intertwined. So when we look under the umbrella of health, sleep, stress, movement, diet. These are our control points. This is what changes things. So get good quality sleep because if you've got a well charged battery, it's going to function better and everything's going to function better. So
Yeah.
sleep is, and good quality sleep is important. When I
Yeah.
say quality, I mean go to bed well before midnight because the sleep
Yes.
that is restful and rejuvenating is the sleep before midnight. And that's a
Mm-hmm.
really important thing, right? So if you need to have more hours in your day, rather wake up
Mm-hmm.
early than go to bed late because there's more benefit in the morning,
Mm-hmm.
and you can't really recharge your battery sufficiently enough by going to bed at 1 a.m. and then waking up at 9 a.m. It doesn't work like
Mm-hmm.
that because
Mm-hmm.
you're messing with your body's clock and the sun
Algorithm.
and everything
Yes.
like that,
Yeah.
right? So sleep as much as you can, right? If you've got sleep issues, work with someone, work on them. Stress, we can't make it go away, but we
Mm-hmm.
can manage it. And most of
Manage it.
us
Yes.
are probably not doing little small things in our day to keep our stress levels down,
Down.
right? So
Mm-hmm.
little things like taking breaks from your computer screen, going and hugging a loved one, making sure you sit down and eat your meal rather than skipping it, going outside and moving your body, getting fresh air, right? There's so many little things you can do, even just closing your eyes and taking some big deep breaths every
Mm-hmm.
half an hour, just simple things where you're not uh, activating your nervous system, but you're activating your parasympathetic nervous system to just relax. So I think manage your stress the way you can. That's important. And then
Mm-hmm.
movement. I'm a
Yeah.
huge advocate for movement. Everybody
Mm-hmm.
knows that I'm a happier
Yes.
person when I move, right? And anyone who's tasted the sweetness of having an active lifestyle
Oh,
knows
yes.
that life is just better. You have more
Mm-hmm.
energy, you're a nicer person. There's just benefits are
Mm-hmm.
endless, right? And then diet perspective is complicated because there's so much stuff online. But in a
Mm-hmm.
nutshell, know your food groups.
Yes.
When it comes to carbohydrates, choose unprocessed carbohydrates as much as you can.
Mm-hmm.
When it
Such
comes to,
as?
so that's going to be uh, the whole grain and the whole wheat versions of things,
Mm-hmm.
right? Rather than the very refined versions of things. So
Yeah.
the less processed it is, the better it's going to be, right? So
Mm-hmm.
if, for example, I'm going to be having, let's say, curry and rice for dinner, instead of having a big plate of just white rice and a few
Mm-hmm.
specks of meat,
Veggies.
and
Yes.
hardly any veggies, I need
Mm-hmm.
to rework that so that I've got a controlled portion of things and I'm choosing a rice that is going to be better for me. So basmati rice, brown rice, those sorts of things, right? Instead of having white bread in the morning, let me have a seeded bread or whole
Mm-hmm.
wheat, whole grain bread, right? So things that are less processed contain more nutrition in them and there is more benefit. So when it comes to the group of foods called carbohydrates, choose the less processed versions where you can. Protein, which is predominantly from animals, choose the lean versions of things, right?
Mm-hmm.
So less fat on your meats, less skin on your chicken, less deep fried meats. Choose the lean stuff. Fish a few times a week is great.
Mm-hmm.
Choose the lean stuff, basically.
Yeah.
And eat lots of fruits and vegetables, right? No one is eating enough vegetables. I probably don't eat enough vegetables as much as I try.
Yeah.
So half a plate of veggies twice a day. That's your goal. To eat lots of veggies, snack on fruits, 1 or 2 fruits a day is a good one. And then you dabble in all the other bits and pieces, nuts, seeds, all of those sorts of things come into your diet as well, right? So if you're focusing on that and you're having less refined sugar, less deep fried foods, less
Mm-hmm.
takeaway, less ultra processed foods, and they make up only 20% of your diet and the rest of your diet is wholesome, that's the
Mm.
base. That's the
Yeah.
base you want to look at. So just have that as a criteria. Go online, look up what is a healthy diet, have a little list for yourself, and then keep asking yourself that question. Do I need to have less processed food? Do I need to eat out less? Do I need to put more veggies on my plate? Keep reflecting on your diet and make one little tweak at a time. One little
Hmm.
tweak at a time.
Yeah,
Focus on that, get good at it, to the next thing. So
yeah.
hopefully that's a good summary.
So with the genetics and the diet, how, for example, if the person doesn't know how to find out about what their genetics might be like, and what would you recommend for that?
Yeah. So if you're following the foundation of a healthy diet and a healthy lifestyle and you have no idea what your genetic predispositions are, that's basically going to cover you.
Hmm.
But
So
of
you
course, you can go online or anything like that and have a look. There's some really interesting stuff available these days where you can actually go and do your genetics and get them
genetic
tested.
test.
The
Yeah.
whole the whole concept of epigenetics is a topic
Mm,
you can go learn more about, because epigenetics is basically the influence of the environment and the choices that we make etc on our genetics, right? So
mm,
you can go and delve in further. If there's an ethnicity that you are that I haven't mentioned and you're not sure what you're predisposed to, yeah, go and ask the questions. Hey, did grandpa have this, or did Nani have this, or what conditions did they have,
mm.
and what did their diet look like? And I know for my mum, her grandfather,
Yes.
he smoked. He ate mitai. You and I were talking about mitai
Mithai,
every
yes,
single
sweets.
day.
Yes, our sweets.
Hmm.
Yes.
Hmm.
Mm, mm,
But even though he had those two habits that existed, he also walked everywhere. He didn't have a car. He
mm,
also ate wholesome food at every single meal.
mm.
And he was so healthy. Like, my parents always talk about him and how he was just this amazing, healthy, super habitual person.
Yes.
And he didn't die from anything genetic related. He lived a really long life, and he was actually had was in a pedestrian accident. That's how he passed away. So it
Oh
wasn't.
wow.
So
Sorry to hear
those
that.
kind of stories for me are also relevant in the sense that I'm like, wow, if I stay active,
Mm,
and 80% of the time make the right choices, still have some mitai or do some of the things that are quote unquote not great
unhealthy,
for me,
like,
because they
yes.
only become bad for me when I overdo it. So the poison is in the dose. The dose is in the poison, right? That's the
Yeah.
saying. Um,
Yes. Yeah, I got you. Yeah, so it's yeah, it's not about the what you're eating, but how you working around it as well, right?
yeah. So if you're
Yeah,
predisposed to high blood pressure, make it a habit that you slowly, gradually reduce the amount of salt in your cooking and get your family and everyone else used to that. If you know that you add more veggies, you add more potassium, you lower your blood pressure, slowly work on that. So
yeah.
just pick something, like pick
So you have
something.
the power
Yeah,
what you put in your body, right?
yeah,
And especially
exactly.
if you are cooking as well. So you have the power to slowly change your family's habit.
Exactly.
Yes.
Yeah,
Yeah.
imagine what a wonderful thing that is to do for your children, to make the effort to make the changes so that they grow up with those benefits and then they carry them
Mm,
on. I
yeah.
think that's a beautiful gift to give your families, to work on changing things, to know, to be the person that went and learned and understood and made the shift and the change so that they benefit you, right? The same way
Yes.
we don't want our kids to watch too much screen because it's bad for them.
Yeah.
Change their diet so that it's good for them too. Yeah.
Yes, absolutely. So we are not just staying in a kitchen and cooking, but it is a big responsibility, right?
Massive.
Yes, absolutely. So, all right. So how do genetics influence women's health across life stages,
Mm,
like fertility, pregnancy, like you always already mentioned PCOS,
yes.
menopause, and how does culture play a role in it? I think we all touched in it a little bit, but yes, would you be able to a little bit elaborate on that, please?
Yes, for sure. So obviously different conditions, especially those that are hormone based,
Mm,
they do look different in different people.
yeah.
So you are predisposed to PCOS depending on your genetics, 100%.
Mm-hmm.
what you experience during your pregnancy or how your fertility is can also sometimes be influenced as well by genetics, right?
Yes.
Um, things like menopause. Like menopause is a really good example. Menopause is like the symptoms that you get, right? Now, menopause is got perimenopause, which is the build up
Mm.
to it.
Yeah.
And that's also split into you see a few symptoms to there's full on symptoms. So I know South Asian women, they experience different menopause symptoms compared
Mm.
to someone who is not South Asian. So
Mm.
they will, for example, experience it slightly earlier in age. They will get slightly different symptoms, so they get more hot flushes, things like that. So there are some things that, we can't change that element, but it's just awareness, knowing, okay, I'm going to experience these symptoms more
Mm.
or less,
Or
right? So
less. Yeah.
if we look specifically at women, it's like, okay, preconception, you've got conditions that you might be susceptible to, like PCOS, endometriosis, those sorts of things. They've all got to do with your hormone balance, your insulin sensitivity, all of those kind of things, right?
Yes.
South Asians are predisposed to vitamin D deficiencies. So there are
Mm.
certain deficiencies and things like that, like once you do fall pregnant, you want to be a little bit more alert for.
Mm.
So things like that. African women, they're going to be more alert for making sure that they are getting their folate on time.
Mm.
Things like that. Or if they have sickle cell in their family, they might want to be genetic testing happening before they. There's so many pieces of the puzzle for that.
Yeah.
If someone's, Pacific Islander, the high risk of gestational diabetes would be something that they want to prepare for. So it's kind of like during pregnancy, there may just be some things that your group of your culture is susceptible to, and some things that you're not. And I've been through the healthcare system of having children here in Australia, and they
Mm.
don't adapt advice to your culture. So our
Mm.
babies, Indian babies, they just ring the alarm bells and tell you that you're having a small baby when it's totally normal for
Yes,
our
I was
body.
told that with both of
Yeah,
my
I'm sure we've
babies,
all gone
too
through it.
small. Yeah, too
Yeah, and
small, and they were worried.
yeah,
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 we did so many extra tests. Yeah, because
not necessary. Why?
mm.
Because if you look at it and you actually did your studies on people from a diverse background, you would learn
Mm.
that South Asian women or Asian women, East Asian women, even smaller, um, we have small babies. We
Yes.
have small babies. You can't compare us to the average Australian Caucasian or a
Mm.
Samoan lady, right? Like we have small babies. And then then a lot of the time, if someone is not culturally sensitive, you
Mm.
get bullied in the session because they don't want to listen to what you have to say, and they just want to make you as a first time mum feel really, really bad and scared that, oh my God, something is wrong with my baby or me. But meanwhile, you're just going to have a small baby because, hey, that's your genetics.
Mm. So
So
there we
that's a
go.
classic example of like something during pregnancy that you might experience that's
Mm.
different. Different babies, different sizes, different growth patterns, all there's slight variations in that for sure.
Mm.
Um,
So
so
yeah, so
yeah,
we have to keep an open mind about where we come from, and according to that, instead of being afraid about it, just do the study around it. And yeah, so yeah, I was scared with the second one. Yeah, but anyway, so
yeah,
that's why we talk about these things, right? That like a professional like yourself, that to bring the awareness around that the different background people, genetic background might have a different, pregnancy and all the, menopause symptoms and that things like that. And so, yeah, thank you for that. So,
yeah,
everyone who has just joined in a little bit later today, we have amazing dietitian Fatima. So, yeah, thank you for being here. So, all right, the last question: can dietary changes really influence gene expressions, or is that a myth?
yeah. So we've sort of touched on this in some ways, and there's a really nice saying that goes, the genes load the gun, but your lifestyle pulls the trigger, right?
Okay.
And I like that one because it's a really great summary of can our lifestyles and what we're doing actually influence us or not, right? So that whole thing, it's not a myth. It is basically the study of epigenetics. There's really cool things like turning off genes and things like that, because of, a shift in your environment, or
Mm,
living in a different place, or having healthier habits. We know that those things are going to happen. Like, that's been
mm.
proven through science, that we can influence our genes
The
through
changes,
through
positive
lifestyle.
changes.
100%. We can't erase our genetics, but we can influence how they behave. That we know
Mm,
for a fact. So diets that are going to be rich in plants, in fiber, in beneficial nutrients, that are going to be low in like ultra processed foods, they support better gene expression, right?
mm,
And there's some really cool stuff in the space of gut health, which is coming about, and we're learning more and more how your gut health, being unique to your environment and all of those things, play an important role in all of this. It's really, really
mm.
fascinating. So
Yeah.
again, going back to the example of how I said, again, I've got South Asian genetics, but I grew up in Africa, and then I migrated when I was 11 to Australia. I mean, imagine what my microbiome
Your
has done.
genetics will be, yeah,
Yeah,
shifted in
I've
so many
probably got
ways.
a whole multicultural community down there
Mm,
doing all sorts of things, because I keep going here and there, right?
mm,
But at the end of it all, if you're going to fixate on these concepts as, okay, right, now I'm doomed, or yeah, I'm going to
yeah.
get it anyway. Well, yeah, you're going to get it anyway because you're not making any effort, right? But
Yes.
everyone's got something that they're predisposed to. Everyone's got a health condition that they're predisposed to, no matter who
Hmm.
you are. That it's not an excuse to not live a healthy life,
Yeah.
right?
Try
It's just
to,
not.
yes, try to do better for yourself and for your coming generations as well, right?
Yeah,
So,
yeah,
yeah, if we
yeah,
can change that and change the genetics towards the better
yeah,
lifestyle and better living,
yeah.
and so we should, and like you said, we can. So that's
Mhm.
amazing.
Yeah, and it's, there's the other space that's really cool, is that in like the psychology world, so the mental health
Hmm.
sort of space, they talk a lot about genetic trauma, inherited trauma, like our family
Mm.
ancestral trauma kind of stuff. There's a word I've gone, is genetic trauma. Oh, it's left me. Anyway, there's a term. And that influence, so say for example, again, I'll give an example from my life, like my great great grandfathers, they left India, Pakistan on boats. Those
Mm.
boats floated around. They were, a few of them were shipwrecked. There were all sorts of things that happened to them. And that genetic trauma, that history, right, of who they were and what they went through, all of those things would have shaped the genetics that came into my family and the habits that we have. And like, every family, you'll know, okay, those people are very habitual. Those people
Yes.
uh get angry quickly. That
Mm.
group of family of people are predisposed to da da da. So the more you know about it, like the more you are aware of yourself, and you realize, okay, this is a trait that I have in me. And I also noticed my mom has it, and my uncles have it, and my
Mm.
grandma has it. Oh, this is from my, from this line of my family, this concept of struggling to deal with XYZ or whatever. So they're just such cool conversations. And all of
Mm.
these things are going to be influenced and
Yeah. Oh,
influence even your
we
health.
yeah,
So it's really cool.
yeah, we could talk for hours. I guess it's half an hour is
Mm.
not long enough, right? So if anyone, what is Yamikan saying? 2:35 a.m. Oh, she, yeah, in Zambia, 2:35 a.m. Oh, bless you.
Yeah, he's checking in. Go to sleep. Get that good quality sleep.
Yes, you need to sleep, and then that is one of the reasons we were talking about, right? Have a good rest. Yeah,
Yeah,
thank you for being here, but at the same time, you need to rest, and
yeah.
then tomorrow you recharge. Your body is all, ready to go. So, yeah, if anyone has any questions, please put in a comment section. Okay, that's great. Thank you so much. All right, so right. So if anyone has a question, please put it in the comment section. And yeah, while we're waiting, please, Fatima, let us know where people can find your amazing work and yourself.
Yeah, wonderful. Thanks, Yummy, for all your support. He's saying that he's gonna go back on his diet plan soon and get healthy again. Amazing. So yeah, if
Awesome.
you want to find me, I am based in Brisbane, Australia for face-to-face consultations. So if you do live in this area, then yes, just get in touch. I have 2 or 3 different practice locations that I work from across Logan and Brisbane. So yeah, just send me a message or anything like that if you need a session. I do have a website that has all the details with regards to all of my different services. So if you're not looking for one-on-one support and you want to do one of my courses or purchase one of my meal plans or anything like that, that's all available through my website. So it's www.culturaldietitian.com. And yeah, you'll find me online, you'll find me over here, and I do telehealth consultations. So no matter where you are in the world, if you are interested in working with me, yeah, again, just jump on my website or
Okay.
jump on my page or just send me a message and we'll start chatting and can
Yeah.
support you in any way
And
you need.
yeah,
Yeah.
it's
Yeah.
amazing that you do telehealth as well. So anywhere around the world, they can reach out to you and yeah,
Yeah,
help
and
us
that's
out.
it. If you're
Yeah.
on private health insurance, and you live internationally, there's certain private health funds that do cover the cost of dietitians because remember,
Mm,
dietitians are registered professionals, which means that we are accountable to someone. To keep my registration, I need to meet certain standards. So these are
mhm.
the kind of people you want to be spending money on seeing because we are, again, registered. And because of that reason, you can get coverage from Medicare, referrals from doctors, coverage from your health insurance because insurance companies recognize our qualification as well. So just from a financial perspective, I always like to put that note in there because people
Mm.
often don't realize that dietetics or seeing a dietitian is
You
part
are
of your
covered.
healthcare plan.
Yeah,
Yeah.
you are covered under the private healthcare. So that is great to know because lots of times that we don't approach because thinking it's gonna be costly as
Mm.
well. So, and that is really good point that people can, go through their healthcare system. So awesome. Fatima is the best, my dietitian and nutritionist for life.
That's
Wow.
hi, Auntie
Yeah.
Shiza.
Very kind
That's
words.
my
Thank you. Thank you
yeah,
so
that's
much.
my number
Yeah.
one fan.
Yes. Thank you everyone for being here. Thank you, Fatima. I truly appreciate your, knowledge and the time and everything you have. And that's why I respect you so much. I
Oh,
always, look up to you. And yes, and a few Zambian family as well here. Thank you so much for everyone for being here. Thank you. And we'll talk to you soon. Maybe I will see you at our event, 5th of
yes,
September.
I will try to come. I'm going to plan to do that. We need to actually meet face to face. But you're
Oh,
most welcome.
absolutely.
We'll do another talk again soon. But thank you for having me as well and for trusting me
Yes.
and always reaching out.
Oh, absolutely. Oh, yeah, we will have to book you in for next year also. Thank you so much,
Okay.
everyone, for being
All
here,
right.
and we will tune in next time. Yeah, have a great day.
You
Bye.
too. Bye bye.
Bye bye.